Good. What's with the face?
It hurt a little bit.
Hi, this is Dr. Thayer. I'm with Laura. She's come up from Tijuana, and she's here for a week plan, and she has been paying for years, 3 years now. She woke up one day, had terrible low back pain, went and had an MRI, said she had a herniated disc, has pain shooting down her right leg, couldn't move. Checked in the hospital, I think had some injections. They've been had her on Tramadol and Lyrica the whole time. And so she's just trying to wean herself off because of the bad constipation and feeling just negative side effects of all this stuff. So she's been weaning herself off this whole year. And as she's been weaning herself off, her pain has been increasing. And so she's never been to a chiropractor before. Last people she's gone to is a physical therapist. A physical therapist actually hurt her in the middle of treatment, and so she ended up going to the hospital for that.
So just 3 years ago, one day I just couldn't sit straight or get up. The pain was so bad. Went to the doctor, started putting me on medication, and then like therapy. After like a month that I finished therapy, the pain came back like double, and I was hospitalized like 3 days. And after that, it was just treatment with Lyrica and Tramadol. But
no other treatment the whole time, just stay on the drugs.
Yeah,
and they recommended surgery.
massage.
Tell us about the surgery they recommended.
Oh yeah. Because of the hernia, they recommended surgery. But
how strongly they recommend it? Did they really want you to do it right then, or what did they say?
Not at the moment, because
right.
I needed to lose some weight. Because they say that if they did, it wouldn't be successful, because maybe later on, because of the weight, it just wouldn't work. So I had to lose the weight, and at the same time, I started decreasing the dosage on the medication.
Tell us about the weight loss. You did a gastric lap band.
Yes, because I wanted to do the surgery, but afterwards I said, okay, I mean, I don't want to do surgery.
Yeah,
so I want other options. I want to look at other options.
She lost 75 pounds.
Yes.
Good.
So
she
far.
said some of her pain came off a little bit, but not so much that she still has all the pain still again.
Yeah.
It came off a little bit because she's on frickin' so many drugs. So, anyways, anything else you want to tell us, ma'am?
No, I mean, it was focused mainly on my lower back and leg, but now it's gone to my neck and shoulders.
Yeah. Headaches every day since she's now off the medication.
A little bit dizzy.
A little dizzy too.
Yeah.
Dizzy every day too right now.
Yeah.
But that's all sort of really come up recently since she's been decreasing all the medication. So, medication 101, guys. You take medication, it covers up your symptoms. It does not fix anything. And now that she's reducing her drugs that the doctors gave her, and they haven't done crap to help her, she's feeling all her symptoms come back again. So she did not get any care. She didn't get better from taking drugs, just covered up the stuff. So if you guys want to cover up stuff and not take care of it, then keep doing that, because she wants to start feeling better. That's why she's here.
Yes.
So headaches, vertigo every day, sleeps like crap for the last year, some foot pain, and constipated. She says from the lap band, it made her really constipated, so she thinks it's a little residual from that. Could be, but I wanted to get that on camera. Anything else you want to say?
That's it.
You ready?
It's a lot.
It is a lot, yeah. Go ahead and stand over here, please.
Yeah.
Let's go through the range of motion and see how you're doing, okay? Go ahead and bend over, touch your toes. How much pain in your back?
Like 4.
4. And go ahead and go back like this. How much pain there?
About the same.
About the same? Okay, now go ahead and look at the floor with your neck. How much pain in your neck at all?
No, just
Look at the
maybe
same?
1.
How about that?
No.
Good. And go ahead and squat to the ground. Remember, knees straight ahead and squat to the ground best you can.
That's about it.
Why can't you go any further?
I feel like I'm gonna go
Fall. Gotcha. How about the weakness in did your legs feel weak too? Right?
Yeah, a little bit on my calves.
Gotcha. Now go ahead and stand up on your toes, please, for 5 seconds. It's difficult, right? Why?
Yeah.
Why is it difficult?
I can't. I feel unbalanced and I might fall over.
One more thing I want to get on camera is that you talked about when your pain is at its worst. When is it at its worst?
Basically in the mornings when I wake up.
Which position makes it worse?
Sitting up.
Sitting
Yes,
up?
sitting in the bed. or standing up.
You told us about laying down. Tell us about laying down.
Laying down, face down. Laying down for maybe, I don't know, 20, 30 minutes. Getting up again, oh, it's painful.
Gotcha. You ready to go?
Yeah.
You scared at all?
No.
You should be.
Oh, okay.
On your back over here.
Okay.
So x-rays, guys, I'm going to show them to you this week. But x-rays right now, pretty straightforward. I mean, not that bad. Definitely some instances of reverse curve, the atlas is worn a little bit, or backside of a line a little bit, blah, 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 blah. But pretty nice for as much pain as she in, not bad. So I think we should help her pretty well. But you can check those x-rays out right now. In this first x-ray, we have a 3 millimeter left imbalance and a 9-degree scoliosis. Here we have a 9 millimeter right short leg and a 10-degree scoliosis. In this one, we have a high reverse curve and 1/3 atlas wear. And in this last view, we have L5 arthritis and significant constipation. For somebody who's never been adjusted before, she is really relaxed. Good.
Okay.
So tell us what that felt like, so everybody can kind of.
Just a little pressure on the neck, and I do feel like a release from my shoulders.
The shoulders. Gotcha. Let's go this way. Good. What's with the face?
It hurt a little bit.
Yeah.
It's subsiding.
Good. This is Laura's first adjustment, so she's a little apprehensive right now, but we're just reminding her not to twist and turn or she will undo my work. So just relax, Laura. Let's kind of listen in to see how she's doing. I can't wait to hear.
The relief on my shoulders. I do feel less tense.
Good.
And not that much pain on my lower back.
Interesting, huh?
Yeah.
We're letting Laura know that she's going to walk down the hall to recalibrate her spine. That means we're going to spread that adjustment from her neck to her toesies. And so just walk straight, look straight ahead, and we'll see how you do. Anything else you want to share before we check you out?
No, I feel
touch
lighter.
Toes. Touch toes.
Oh, wow.
Yeah. Oh, wow, what?
I think I went lower than before.
Yeah, of course. How about your back pain was a 4?
Maybe a 2.
Gotcha, so half. So you can give them the bird right now. You want to give them the bird?
No.
The bird, you know what the bird is, right? Okay, gotcha. I don't know if in Tijuana they do the bird right?
Yep,
Yeah.
Mexican style.
Exactly. Go ahead, go back. Now I want to see what the Mexican style is. Good. That was a 2 before. I was a 4 before.
Yeah, like a 2, yeah.
Good, gotcha. Neck, look at the floor real quick. That didn't hurt before. Look at the ceiling. That didn't hurt, right?
No.
Now the fun one, spread your feet a little bit. Squat.
Okay. Yeah, I think it went lower this time, yeah.
And look, you're staying down there too.
Yeah.
How about the fall? You said you were going to fall forward.
Yeah, I thought I was going to.
How was that this time?
I think I controlled my balance better.
Yeah. Anything else you felt with that?
Less strain on my
Left side.
Yeah.
Good. So last thing, stand up on your toes, please.
Still unbalanced there.
That's fine. How is it different than before?
I think it's almost the same.
Yeah.
Okay.
Anyways, you guys can see the difference. Hi, Dr. Thayer here with Laura. This is the end of 1 week with her. She's doing, I think, a little bit better. I'm going to turn it over to her because you guys always think I put words in people's mouths. And you're like, you do the same thing, you stuff and that. I know it's always the same thing, but you know something? The stories are awesome. People come here, they get better. And she had no clue of how this worked. She just trusted the process, saw me on YouTube, and went from tons of pain to feeling a lot better, I think. Laura, how you doing? What's going on?
So I'm doing much better. I'm off medications totally. It is very, it has to do a lot with willpower and trusting your indications.
Personality?
Yes,
personality?
and
Yes.
indications.
What are you smiling for?
The pain has, dropped significantly. I still have some maybe soreness on my neck and shoulders, but I try to do the breathing and changing my posture to improve and not feel any pain.
What I tell her to do.
Yes.
Yes.
It's difficult, but I'm gonna try it.
Good. So tell us how much better do you feel, percentage-wise?
Percentage-wise, I think maybe 70-80% better.
Cool. And so you've been in pain for 3 years, right? And taking medication.
Medications for
and what was the medication you took again?
Lyrica.
Lyrica, tramadol for years. Totally drugged up, and she's been trying to get off.
Yes.
She's been trying to get off the medication, so she's been slowly decreasing it. And you saw in the first video. And as she decreased it, her pain kept going up higher and higher.
Yes.
And then she went off completely cold turkey a couple weeks ago, and she was in tons of pain. So again, drugs only mask the pain, so it doesn't fix you guys. So it just puts off the inevitable. Come get your ass in here. Let's get you better instead of making you guys drug addicts. You said that. I know. Sorry. Well, you know, you gotta say those kind of flamboyant things because people don't only respond to that stuff. You can't be like, you know, let's get you off the medication because it could be very bad for you. Nobody hears that stuff. But if I call you a drug addict, then they're like, oh my God, stop that! Yeah, so anyways.
Yes.
You gotta have big words. Big words people listen to. Okay. So let's go through these things one by one. Right low back pain.
Basically away. I mean, it's sporadic.
Good, and that's what you came in for. Neck pain, traps.
Yeah, I felt relief on the first day. It just comes and goes, but it dropped significantly.
Headaches every day.
Maybe 20% of what it was originally.
Gotcha. Okay. Sorry.
He's having fun.
Neck pain. I just love to hear myself. I love to hear myself talk. Actually, I love to hear good things about me. So every day, dizziness.
That went away.
Good. Sleep. How's your sleep?
We
talked about two different things. Yes.
Yes.
Two different things. Go ahead, tell them.
Yes. The bed is stiff and kind of. I'm not used to sleeping on a stiff bed, but I wake up more rested, even though
throughout the night you have some pain.
Yes.
Okay, so tell them what we've been talking about with the Tempur-Pedic bed, the piece of crap Tempur-Pedic bed you have. You paid a lot of money for that your husband's like, I can't wait to get rid of.
Yes.
Compared to the hotel bed you're sleeping in.
Oh, I mean, it's night and day, and I know I'm supposed to sleep on a firmer bed.
Yeah. And she's sleeping on the worst bed. Worst bed ever.
Well, what am I going to do? Because
the residual checks from Tempur-Pedic are not coming to me. I get that, but get off those soft bed, guys. That's terrible for your spine. Go ahead. Anything else?
What else?
Okay, so anxiety. How's your anxiety this week?
No, been relaxed.
How about your feet? Your left foot. Left foot. Left foot.
Left foot.
Remember the pain in your foot?
Yes, but it's maybe 10% now.
Yeah, better too.
Yes.
Now, what did I treat you the whole time here? What did I treat?
The neck.
And
focus on the neck.
Did I rub your feet?
No.
Did I ever massage your back?
No.
Did I crack anything else but your neck?
Nope.
Okay. Tell them how much you understand about what I do.
Well, I try to ask questions and understand about why only the neck, and it's all has to do with equilibrium or.
Good, perfect, yes.
Yes.
Good, she's listening.
Yes.
5 days later, she's doing pretty good. I like this girl. She has come not very far, a couple hours, but complete. Again, she put trust in coming here, which is neat. But she really didn't understand what we were doing.
I just knew you were going to be focused on the neck.
But she just kept going, how was the neck? What? And didn't you call back your sister and tell your sister that you did this? And like, or did you just call back and tell them, like, I'm feeling better. I'm feeling better. And they're like, what are you doing? What's going on?
Told the family what was going on. Yeah.
And they're like, how does that work? But again, I'm happy that she's here. I'm happy she's feeling better. She needs to come back and see me some more. But so far, so good.
Yes.
Good. Let's get you adjusted on your back.
Okay.
And please be kind about my dance moves. Those weren't my full dance moves. That was just a modification of chiropractic dance moves, just so that you guys be entertained while you're listening to her story. So it's not my real dance moves, okay? Just saying. Beautiful. Okay, let's go again. Beautiful girl. So good, so good. She wore makeup for you too, guys. It's looking good.
Well,
what's wrong with
have
that?
to look
exactly
good for the camera, right? Yeah, it took me time.
Took her time. She's learned. It's 5 days later, guys, and this is quite a transformation.
Yes.
Good. So, Laura, thank you so much. It's been a wonderful pleasure to take care of you, and you've been very sweet to do the video.
I know I might have to come back and get readjusted.
Well, I'm always here for you. You're lucky that you're only 2 hours away.
And try the food trucks in TJ.
Yeah. She's trying to talk me into the food trucks and TJ. I told her I'm scared to go to TJ.
No,
you know, all those cartel are down there.
No.
But she goes, no, there's some great food down there now. It's really come back, and it's really good down there. So yeah, she's gonna map out some places for us. So thanks for watching, guys. Hope you guys learned a lot. See you guys next time. Yeah.